Hi, everyone. This is Ken with Ken's Insurance Agency. We're a full insurance brokerage. We're coming to you today to talk to you about health insurance and uh, the different types of health insurance that basically an individual or family can get. We'll be talking next um, webinar about Medicare. So stay tuned for that. Also, remember, open enrollment is here for both Medicare and for your healthcare.gov enrollments. So, and we are a broker for those. So, if you want help with those, give us a call if you're in Mississippi, Tennessee, Arkansas, Louisiana, Alabama, or Michigan. Our number is 662 912 3914. Again, that number is 662 912 3914. We look forward to helping you. And we've basically gotten started. You have for the individual and the family, you got your ACA, which is also known as Obamacare, which is also known as the exchange, which you sign up for on healthcare.gov. This is where you can get a subsidy, cost sharing to help pay for your plans. Some people I've seen get free plans. Some people I've seen take basically a $1,200 plan and turn it into basically $26 a month for them and their family. So basically, the plans start out as very unaffordable. And if your income and family size is right, then you get basically um, a savings, which they look at household gross income and they look at the total household size, whether they're covered on the policy or not. And then basically things like children, they may qualify to be on CHIP. If you've got somebody that's disabled or if your income's too low, you may qualify for Medicaid. So there's different options, and we as brokers help you with all those options. So that's just one of the pluses. We also know the best way to look at how to enroll. I have access to all the carriers in my states. So um, no matter which plan is best for you, we have the way to enroll you. The next um, thing that we've got that can help you is the ACA alternatives. These are basically like fixed indemnity type plans. You get no cost sharing, no subsidy to help pay for them, but they're more affordable on right off the bat. The downside to them is they pay a fixed amount per thing. So, one, when you go to a doctor, it doesn't pay much. So, we recommend you negotiate a cash rate and not let them know you have insurance so that they give you the best cash rate and then file the claim yourself. This way, you break even or come out basically being out about $20 at most uh, on your doctor's visits. Now, when you go into the hospital, naturally you'll want to file it on your insurance. Um, these plans, you can also get a check back from the insurance company that will basically be the unused amount of um, any benefit that you were supposed to be using for a medical event. So, like if you go into the hospital for a heart attack, the total covered for the hospital stay and everything that was done was, let's say, 30,000. and let's say the hospital after negotiations and all was 15,000, then you'll get a check for 15,000 that you can use any way you want. So that's the plus to it. The next type, which is another more affordable plan, is your short term. The problem is with these, they operate like the old type of health insurance, and they will not cover pre-existing conditions ever. They're also based to be good for anywhere from 30 days to 364 days. So that's one thing that you need to be aware of. Some states let them automatically renew for 2 to 3 years, turning them into short duration medical health plans. So be aware of that. Some companies have this option. So be aware. They are very affordable, but if you got a pre-existing condition, it hurts you. The ACA alternatives on their pre-existing condition clause, it's 12 to 24 months on certain conditions that basically won't be covered for 12 to 24 months. If it's outside of those certain conditions, then they'll cover it, but they rate it up. So that lets you know how that works. Then you also have your accident, your cancer, your critical illness, your hospital indemnity, your disability, your dental, your vision. These plans cover if a certain specific event happens. And when that certain specific event happens, then basically the plan pays you money. You can use the money for medical expenses, for your home, mortgage or your rent or your electric bill, pretty much anything like that. You can even take it to the casino and try to double it if you want. Of course, if you lose it, you lost it. They're not going to replace it. But they will pay you the benefit amount. Also, with these plans, it is stackable. So let's say you have an ACA alternative that pays you 15,000. You have an accident plan that's going to pay 8,000, and a hospital indemnity plan that's going to pay, let's say, 20,000. You can collect off of all those plans for one event. And let's say you also got a disability plan that basically you've been off of work and you're going to be off of work for a long period of time. You can collect off that disability plan also and get money. So there's many ways to stack these and use them and be able to benefit. So that covers that. We want to show you one other thing that we got that's a health related product. And then we'll basically tell you once again our coverage area and how to get in touch with us. These will also be posted on our social media pages like Facebook, YouTube, and on our website. So you'll be able to get in touch with us through those means also to contact us to schedule an appointment and to get help with your health insurance and other needs.
A Real Money team is back, saving you a lot of money on your doctor bill. Americans, on average, spend up to $200 for each doctor visit. So imagine being able to visit your doctor without leaving home and cutting the cost in half. ABC's Paula Ferris with a way to keep that money in your pocket.
With 3 growing boys, the Allspaws from Dayton, Ohio say their home away from home is often the doctor's office.
We really do have a stack of medical bills, and it overwhelms me.
For the boys, $90 each visit, $100 for mom and dad, and the costs are adding up.
Just wondering, is there a better way?
According to our healthcare consumer advocate, Michelle Katz, there is. It's a brand new high-tech medical service.
Hi.
But for most families, Michelle says they don't even know it's an option or figure in the extra costs.
It costs money from work to get all the boys in the car, drive down, to wait a few hours to get a diagnosis that you might already know about.
It's used to treat minor ailments like cold symptoms, which alone account for nearly a quarter of family doctor's office visits.
It's starting here.
Phil's trying it out for what he thinks is poison ivy.
Well, it'd be $100 just to tell me that I got the poison ivy that I know I have.
Taking a picture.
I have the picture.
Uploading it and answering a few questions. An hour later, Phil gets a call from a doctor, a prescription, and fills it at his pharmacy.
We've got a very affordable alternative to an emergency room for non-emergent care.
Dr. Howard says telemedicine is to help families stay healthy in between regular doctor's office visits. In all, Phil's bill was about half of what it usually costs him to visit the doctor's office, and Michelle estimates the Allspaws can save more than $2,600 just this year.
I'm amazed. I am simply amazed.
That's real money!
Sometimes it takes a little while for a new idea to catch on, but when it does, watch out. Just look at Teladoc, TDOC, the world's largest virtual healthcare provider. We've been following this story for over a decade, ever since Teladoc was still a tiny startup. I've always thought it had an amazing concept. Let people have video conferences with their doctors. You shouldn't always have to go to the doctor's office to get a medical care. Hey, sometimes you get sick when you go to that office too, let's face it. Not long ago, Teladoc came public, 2015. The stock quickly went into free fall, plunging from the 30s to the single digits in a matter of months. Since then, though, it's been a rocket ship, a deserving one. Last year, Teladoc more than doubled. It's up more than 60% just from 2018. Now we're in a situation where the results are speaking for themselves. Plus, just last week, the company announced that it's buying a competitor, Advanced Medical, and its stock shot to new highs. Let's check in with Jason Gorovic. He's the CEO of Teladoc, to learn more about this deal and his company's prospects. Mr. Gorovic, welcome back to Mad Money. Good to see you, sir. How are you? I gotta tell you something. You used to be very pleased by what I say. I posted in this morning on my Twitter file that what are people's experiences with Teladoc. I have most people are very critical on Twitter. There was not a single negative experience. It was just positive experience after positive experience after positive. What are you doing?
You know, it's funny you say that. I used to run health plans. I got a lot of hate mail when I ran health plans.
I figured I'd get a lot of hate mail when I put your name up.
Now I get fan mail. Maybe not as much as
tell
you,
me
but
about
I get
that.
a
I
lot
love
of
this
fan mail.
contrast.
No, it's great. It's we're delivering care to people where they need it, when they need it, on their terms, right? And that's how the healthcare system should work. And it's nice. Consumers are understanding it. Payers are understanding it. Employers are understanding it. And we've been fortunate to be the beneficiary of that.
One of the tweets was someone got sick in the car, pulled over, called, got a diagnosis. Can it be that simple?
Oh, it really can. Yeah. I mean, you know, technology being what it is, we can now match a doctor with a patient in their jurisdiction where they're licensed, matched up with their specialty, and take care of them in a matter of minutes. And, you know, look, people get sick not on regular schedules.
Right. Now, it is 24/7. Also, this new acquisition, to me, makes you the worldwide leader.
That's exactly right.
Did you know that in the course of a year, you'll see your doctor close to 3 times for one of these typical conditions? And for your kids, almost 4 times. So what do you do about it? You normally have 3 options. The first thing you should do is call your primary care physician. But if getting an appointment takes too long, or even worse, what if traveling makes it impossible? You could head to an urgent care clinic, but do you want to spend $150 to wait in a room that might be full of sick people? And then there's the emergency room, but that would cost $750. And we're really sick people. Wouldn't it be great if treatment could be simple? That's what Teladoc is for. This is how easy it is to use. First, sign up and fill out some health info. When one of these strikes and your doctor is unavailable, go online or call Teladoc to request a consultation with a U.S. board-certified doctor. Get on a call or video chat with your doctor who is licensed in your state. Explain every detail of your issue. There's no rush. Take as long as you need. The doctor will listen carefully. And when enough details are given, we'll diagnose what you have. A prescription is sent to your local pharmacy if necessary. All of this was done in less than an hour. Average amount of practice experience of Teladoc doctors, 15 years. Average time it takes to get a call back from a Teladoc doctor for quality care you need, 22 minutes. 91% of all medical issues resolved. 97% of customers satisfied. Who said getting quality care has to be complicated? Try it once. You'll love it.
What is that?
A bottle.
A bottle. What's in the bottle?
Nothing.
Nothing's in the bottle. All right.
3. Mom, come on.
I'm still working. I just need more help from you.
I'm doing the best I can.
I feel like everyone is leaning on me to do everything, Mom.
You know, it wasn't always easy with you and your dad either. But you're losing out on moments you aren't going to get back. Maybe it's time you talk with someone.
Hi. Thanks for seeing me.
I'm glad you scheduled some time. How can I help? Make some mental notes, and we can talk about it next time.
Thanks, Dr. Brown. Let's meet next week. This castle needs a dragon, huh? Arr.
They're finally asleep. How are you?
I'm good. I think we're gonna be all right.
Do you not have insurance for prescriptions? Not enough coverage or no coverage at all? Are you not getting the medicine you need for care because of the cost? Despite for almost a decade, chain pharmacies nationwide have been selling select generic drugs for as little as $1 per week, medicine cost is still a burden to households across the United States. Our program will lend you a hand. Now that you have access to the doctor with our teledoctor service, let's get the prescription worked out. If your insurance plan does not cover the cost of all your medications, or if you do not have insurance and you choose the cost-effective generic drug route, either way, our plan will drive down the out-of-pocket expense. Get discounts at over 58,000 national chains, regional chains, and independent pharmacies. Get 20% to 60% off retail prices for generic drugs and 20 to 40% of name brand drugs with no limits on quantities. Use mail order pharmacy as well and purchase up to a 90-day supply of your maintenance prescriptions. Our membership card is the gold standard for prescription savings. Enroll today. I know what the next question. Don't worry, we have the answer. Your healthcare savings plan also includes 15% to 35% off normal retail prices for frames, lenses, and specialty items, such as resistant coatings and ultraviolet protection. Contact lenses and even LASIK and PRK procedures also receive discounts, up to 15% off retail prices as a matter of fact. This keeps money in your pocket should you need glasses, contacts, or ophthalmology services at any time. Just present your membership card and save all around. Enroll today.
If you don't have a roadside assistance plan for your car, you may want to get one soon. One of the most common things we never think about until it happens, transportation issues. The winter and fall months are when most drivers need help with such issues as dead batteries, flat tires, and keys locked inside their car. Spring and summer are filled with road trips and more time behind the wheel. You could miss work, family activities, important dates. Never be stranded again. In our package, you have access to emergency road service 24 hours a day, anywhere in the US and Canada. We deliver gasoline, change tires, provide jump starts, unlock the vehicle, winching and extraction services, and delivery and installation of parts. We'll also tow your covered vehicle to a location of your choice. We do it all to keep you on the road. Enroll today.
It seems like AIA covers everything and truly simplifies your life. But something is missing. What about man's best friend? Well, we have that covered too. Pets are unpredictable. While it's hard to anticipate accidents and illnesses, our affiliations with Nationwide helps make it a little easier to be prepared for them. From preventative care visits to significant medical incidents, Nationwide provides protection for pets when they need it most. Nationwide policies cover a multitude of medical problems and conditions related to accidents and illnesses, including cancer. Coverage is available for dogs, cats, birds, and exotic pets. Plus, optional wellness care coverage reimburses for vaccinations, flea tick preventative, and more. Members are free to use any veterinarian worldwide, even specialists and emergency care providers. Best of all, members are eligible for preferred pricing, which makes this peace of mind protection even more affordable. You're free to use any vet, anywhere, receive preferred pricing as an AIA member. Also, our 24/7 vet helpline is available as a service to all pet insurance members, a $150 value. Tell a doctor for pets. That's right. All pets deserve to live life to the fullest. That's why we're there for the big stuff, the small stuff, and all the stuff in between. Enroll today. The AIA membership is the gift that just keeps giving. You earn AIA rewards just for being a member. Use your rewards to save on travel, gift cards, merchandise, and more. The savings are available to the primary member plus their dependents. Save up to 40% on 13,000 hotels and condos worldwide. Enjoy 10% discounts on popular dining and retail gift cards. Get up to 80% savings on the daily deal. Save an average of 46% on software, electronics, cruises, and more. As a new AIA member, you receive $250 in AIA rewards in your own online account. Plus, an additional $50 in rewards will be deposited each month you remain an active member. To start using your AIA rewards, simply log in and start saving. Enroll today. Association RX. What if you knew the cost of your medicine before you went to pick them up? And what if those drugs were tiered and capped for your benefit? Look no further. Select our pharmacy add-on to your Simplify package. Our relationship with Association RX has a network that includes over 60,000 pharmacies throughout the U.S. The network includes national chains as well as thousands of independent pharmacies. Up to 65% savings on generic medications, with overall average savings of 40% across brand and generic medications combined. This program is designed to help you find drugs within the same therapeutic class as a drug you may be currently taking. Most of all, this program is designed to save you money on your prescription drug costs. This program offers 4 tiers of saving. Tier 1. The first tier is generic drugs that will be available to you for a payment of up to $10. Tier 2. The second tier is brand name drugs and select drugs that will be available to you for a payment of up to $20. Tier 3. The third tier is brand name drugs and select drugs that will be available to you for a payment of up to $50. Tier 4. The fourth tier is brand name drugs that we have negotiated special network pricing for you. For special network pricing, present your card at a participating pharmacy. You can visit www.associationrxcard.com for more details. Log on and check the price of the drug you are looking for and see participating pharmacies. To get the most out of this program, you should ask your doctor to prescribe a drug within the first 3 tiers if possible. Secure your pharmacy needs with AIA. Enroll today. Dental. Everyone wants that perfect smile and that amazing treatment plan. Add on dental to our Simplify plan today. Now, our members can save 5% to 60% on virtually all dental procedures. Since the dental program is administered by Carrington International Corporation, you now have access to one of the largest dental networks nationwide. Members will pay the discounted rate at the time of service. Receive unlimited access to care with no limits on the number of visits. The procedures range from cleanings and fillings to root canals and crowns. Savings on orthodontics are available for both children and adults. All dentists must meet highly selective credentialing standards. Visit any participating dentist on the plan and change providers at any time. You can smile again. Secure your dental options with AIA. Enroll today.
So with this being said, one thing I want to remind you is that when you get Teladoc with your regular health plan, it usually has a copay, and we're not charging you a copay to use it. So every time you use it with your health plan, you pay a copay generally. Also, you don't get the telecounseling and all these other benefits when you get it with your health plan, whereas when you get it with us, basically you get all these other benefits. Now, the tiered pharmacy and the dental are add-ons, so they're a little extra than our baseline package. Everything else is included in the baseline package, $49 a month and a one-time fee of $49. So that lets you know that we look forward to helping you. With the Teledoc, our coverage area is nationwide. Once you get it, if you go to Canada, you're also covered. But we can only write it within the United States. Everything else, as far as the health plans, the supplemental health, we can help you with those, and also with our other products like life and auto and homeowners and retirement planning, estate planning, even commercial insurance and setting up a benefits package. We can help you with these if you're in the states of Mississippi, Tennessee, Arkansas, Louisiana, and Alabama and Michigan. So please feel free to contact us. Our number is 662-912-3914. Again, that number is 662-912-3914. And have a nice day.